Right, okay. My name is Professor Hoyne. I'm a consultant psychiatrist and professor of psychiatry. I'm editor of Global Psychiatry Archives. This is an interesting paper because it's from our editor-in-chief, Professor Christopher Paul Szabo. The other thing is we try to have a few papers on personal developments of famous people in the subject of psychiatry. And in this respect, we gave him quite a bit of freedom. And Christopher used his freedom to talk about his research, which is heart of his interest, and also coping with different events in his life. Anyway, so this is an interesting paper about his eating disorder, and it starts with giving a little bit of the relevance of eating disorder. And interestingly, in the up to the 90s, there hasn't been any diagnosis of eating disorders in female Black South Africans until the 1990s. So Christopher, he started his training in South Africa and became a specialist in 1992. He worked at Tara Hospital, and which is a department of psychiatry at the University of Witwatersrand. And since then, he always continued to work on this issue. So he immersed into psychiatry and left Tara in 2004. And on the other hand, he worked in different areas, again, at the academic and research. But his research on learning on eating disorders was very important in his country. Anyway, so he was the first one to describe that eating disorders were affecting Black South African females. That's a paper in 1995. And he later looked at the prevalence of these issues and the influence on the medication and on the development of the community. So his clinical experience was focused on this. He was guiding a department on this. And he found that some of this, what he described, was very similar to Western societies. So there wasn't that much of a difference, and there were even male sufferers of eating disorders, usually anorexia nervosa, but also binge eating. And there was also an interesting paper on the relevance of the religion. So I mentioned family interest, also the interest of the media. Interestingly, he was once asked to comment on the South African version of the Playboy and gave some ideas and information about eating disorders and the body image of patients. So he developed some type of resistance training for people with hospitalized anorexia, and so it was a difficult time. And he published quite a few papers on this, and I can show you some later. But I would also say that that he was very much influenced by clinical work, and he published about anorexia nervosa and other eating disorders. These are some of his papers. I'm just coming down here to his papers. Professor Szabo, interestingly, he didn't look at our recommendations, authors' recommendations, because some of the alphabet here is a bit broken. Anyways, we had quite a team of people. He published some papers with master's students and PhD students. So the one from 1995 is the one where he's very proud of that. Trying to find this, the 1995 with some authors. Yeah, this is the one, Eating Disorders in Black South African Females, a series of cases. That was a first start, and he continued his research on that. He's a very nice guy, by the way. I met him at our publication committee of the WHO, and I'm very grateful that he joined us as editor-in-chief. I hope you have time to read this very interesting paper on his life and his involvement in eating disorders in South Africa. Thanks for your interest. And if there's any mistakes, just blame me for that. And if you read the paper, you certainly will enjoy that. If you want to see more of our literature and papers or conference presentations, please check our website of the journal and this YouTube channel. Yeah, I would like you to invite you to subscribe to that. And thanks a lot for your interest. Okay. Bye-bye.